Question 1. Which action best represents the nurse's first step in applying clinical judgment when caring for a newly admitted patient with shortness of breath? A. Assess airway, breathing, and circulation. B. Review the provider's admission orders. C. Formulate a nursing care plan. D. Educate the patient about treatments. Answer. A. Assess airway, breathing, and circulation. Rationale. Clinical judgment begins with recognizing and prioritizing cues. ABC assessment is the highest priority in a patient with respiratory distress. Reviewing orders, planning care, and education occur after immediate life-threatening concerns are assessed. Question 2. A nurse is caring for 4 patients. Which patient should the nurse assess first? A. A patient with chronic back pain requesting medication. B. A postoperative patient with a heart rate of 128 per minute. C. A patient awaiting discharge teaching. D. A stable patient requesting assistance to the bathroom. Answer. B. A postoperative patient with a heart rate of 128 per minute. Rationale. Prioritization is a core clinical judgment skill. An abnormal vital sign in a postoperative patient may indicate hemorrhage or shock and requires immediate assessment. The other patients are stable and non-urgent. Question 3. Which components are part of the clinical judgment model? Select all that apply. A. Recognizing cues. B. Analyzing cues. C. Prioritizing hypotheses. D. Evaluating outcomes. Answer. A. Recognizing cues. B. Analyzing cues. C. Prioritizing hypotheses. D. Evaluating outcomes. Rationale. NCLEX repeatedly tests the full clinical judgment model. Recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. All listed options are correct components. Question 4. The nurse notices a medication error was made by the previous shift. What is the nurse's priority action? A. Complete an incident report. B. Assess the patient for adverse effects. C. Notify hospital administration. D. Document the error in the nurse's personal notes. Answer. B. Assess the patient for adverse effects. Rationale. Patient safety is always the priority. The nurse must first assess the patient to determine harm. Incident reporting and notifications occur after patient stability is ensured. Personal notes are inappropriate. Question 5. The nurse is delegating tasks to unlicensed assistive personnel, UAP. Which task is appropriate to delegate? A. Assessing pain after medication administration. B. Teaching a patient how to use an incentive spirometer. C. Measuring and documenting vital signs on a stable patient. D. Evaluating the effectiveness of an intervention. Answer. C. Measuring and documenting vital signs on a stable patient. Rationale. Delegation requires understanding scope of practice. UAPs may perform routine, non-invasive tasks on stable patients. Assessment, teaching, and evaluation require nursing judgment and cannot be delegated. Question 6. True or false? The nurse should rely primarily on intuition rather than evidence-based practice when making clinical decisions? A. True. B. False. Answer. B. False. Rationale. While experience supports intuition, NCLEX emphasizes evidence-based practice combined with assessment data and critical thinking. Decisions must be supported by research, standards of care, and patient data. Question 7. A patient refuses a life-saving blood transfusion due to religious beliefs. What is the nurse's best action? A. Attempt to persuade the patient to accept treatment. B. Respect the patient's decision and notify the provider. C. Administer the transfusion in an emergency. D. Request family members override the decision. Answer. B. Respect the patient's decision and notify the provider. Rationale. Ethical clinical judgment requires respect for patient autonomy. A competent patient has the right to refuse treatment. The nurse must communicate the refusal and continue supportive care within legal boundaries. Question 8. The nurse receives a change of shift report using SBAR. What does the R represent? A. Response. B. Recommendation. C. Review. D. Report. Answer. B. Recommendation. Rationale. SBAR is a most repeated NCLEX communication framework. R stands for recommendation, which guides the next steps in patient care and supports clear clinical decision-making. Question 9. Yes or no? Should the nurse question a provider's order if it appears unsafe for the patient? A. Yes. B. No. Answer. A. Yes. Rationale. Advocacy is a key element of clinical judgment. Nurses are legally and ethically responsible for questioning unsafe orders to protect patient safety. Blindly following orders violates professional standards. Question 10. A nurse evaluates a patient after administering pain medication and notes reduced pain and stable vital signs. Which phase of the nursing process is being applied? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Answer. D. Evaluation. Rationale. Evaluation involves determining whether interventions achieve desired outcomes. Assessing the effectiveness of pain relief and monitoring vital signs confirms whether the intervention was successful. Question 11. A nurse notes a postoperative patient has a blood pressure of 88/54 millimeters of mercury, heart rate 118 per minute, cool skin, and decreased urine output. Which hypothesis should the nurse prioritize first? A. Acute pain response. B. Hypovolemic shock. C. Medication side effect. D. Anxiety-related response. Answer. B. Hypovolemic shock. Rationale. The nurse must prioritize life-threatening conditions. Hypotension, tachycardia, cool skin, and oliguria strongly indicate hypovolemia. Pain and anxiety do not explain decreased urine output and hypotension. Question 12. The nurse is analyzing cues for a patient with confusion, restlessness, and oxygen saturation of 86%. What is the nurse's best next action? A. Apply oxygen and reassess. B. Document findings. C. Notify the provider. D. Perform a neurological assessment. Answer. A. Apply oxygen and reassess. Rationale. Taking action to address hypoxia is the priority. Oxygen saturation of 86% is critical. Documentation and provider notification follow stabilization. Neurological assessment is secondary to correcting oxygenation. Question 13. Which findings increase a hospitalized patient's risk for falls? Select all that apply. A. Orthostatic hypotension. B. Use of opioid analgesics. C. Call light within reach. D. Unsteady gait. Answer. A. Orthostatic hypotension. B. Use of opioid analgesics. D. Unsteady gait. Rationale. Fall risk increases with hypotension, sedating medications, and impaired mobility. Having the call light within reach reduces risk and is a protective factor. Question 14. A nurse receives conflicting information from a patient and family regarding advance directives. What is the nurse's priority action? A. Follow the family's wishes. B. Delay care until clarification. C. Verify documentation in the medical record. D. Ask another nurse for advice. Answer. C. Verify documentation in the medical record. Rationale. Legal clinical judgment requires reliance on valid documentation. The nurse must verify advance directives before acting. Delaying care or deferring to family without confirmation is inappropriate. Question 15. The nurse must delegate care for 4 patients. Which patient requires direct RN care? A. Stable patient needing assistance with feeding. B. Patient with new onset confusion. C. Patient requiring routine vital signs. D. Patient ambulating with a gait belt. Answer. B. Patient with new onset confusion. Rationale. New onset confusion requires assessment and clinical judgment, which cannot be delegated. The other tasks are routine and appropriate for assistive personnel. Question 16. True or false? Re-evaluating patient outcomes after an intervention is optional if the patient appears stable. A. True. B. False. Answer: B. False. Rationale: evaluation is a mandatory step of the nursing process. Even if a patient appears stable, outcomes must be reassessed to confirm effectiveness and detect subtle deterioration. Question 17. A nurse questions a medication dosage that exceeds the safe range. Which principle of clinical judgment is being applied? A. Accountability. B. Advocacy. C. Delegation. D. Time management. Answer: B. Advocacy. Rationale: advocacy involves protecting the patient from harm, including questioning unsafe orders. Accountability is broader, while delegation and time management are unrelated to medication safety. Question 18. The nurse observes early signs of sepsis, but no provider order is in place. What should the nurse do first? A. Wait for lab confirmation. B. Initiate facility sepsis protocol. C. Document findings only. D. Reassess in 1 hour. Answer: B. Initiate facility sepsis protocol. Rationale: evidence-based practice supports early intervention. Many facilities allow nurse-initiated sepsis protocols to prevent deterioration. Delaying care increases mortality risk. Question 19. Yes or no? Should the nurse document an incident report in the patient's medical record? A. Yes. B. No. Answer: B. No. Rationale: incident reports are confidential quality improvement tools and should not be documented in the patient's chart. Only objective patient assessments and outcomes belong in the medical record. Question 20. A nurse evaluates multiple outcomes after an intervention and finds the goal was partially met. What is the nurse's best next step? A. Discontinue the care plan. B. Modify the plan of care. C. Continue the same interventions. D. Notify the provider immediately. Answer: B. Modify the plan of care. Rationale: clinical judgment requires adapting care based on evaluation findings. A partially met goal indicates the need for revision, not abandonment or automatic provider notification unless the patient is unstable. Question 21. A nurse reviews cues for a patient with fever, heart rate 122 per minute, respiratory rate 28 per minute, blood pressure 90/56 millimeter of mercury, and altered mental status. Which condition should the nurse prioritize? A. Anxiety response. B. Hypovolemic shock. C. Septic shock. D. Medication reaction. Answer: C. Septic shock. Rationale: fever, tachycardia, hypotension, tachypnea, and altered mental status indicate sepsis with progression to shock. Anxiety and medication reactions do not explain hypotension and fever together. Hypovolemia lacks infectious indicators. Question 22. The nurse identifies sepsis as the priority hypothesis. Which actions should the nurse take immediately? Select all that apply. A. Obtain blood cultures. B. Initiate IV fluid resuscitation. C. Administer prescribed antibiotics. D. Delay treatment until lactate results return. Answer: A. Obtain blood cultures. B. Initiate IV fluid resuscitation. C. Administer prescribed antibiotics. Rationale: early sepsis management requires cultures, fluids, and antibiotics without delay. Waiting for lactate results delays life-saving treatment and increases mortality. Question 23. After interventions, which finding best indicates the actions were effective? A. Heart rate decreased to 96 per minute. B. Temperature increased slightly. C. Urine output 35 milliliters per hour. D. Blood pressure remains unchanged. Answer: A. Heart rate decreased to 96 per minute. Rationale: improved heart rate reflects better perfusion and response to treatment. Persistent hypotension, low urine output, or rising temperature indicate incomplete response. Question 24. A nurse must decide whether to escalate care. Which cue most strongly supports activating the rapid response team? A. Mild restlessness. B. Oxygen saturation of 88% on room air. C. Pain score of 7 out of 10. D. Family concern about condition. Answer. B. Oxygen saturation of 88% on room air. Rationale. Hypoxia is a clear indicator of clinical deterioration requiring immediate escalation. Pain and restlessness are secondary. Family concern alone is not a physiological trigger. Question 25. The nurse evaluates outcomes and notes persistent hypotension despite fluids. What is the nurse's next best action? A. Continue monitoring only. B. Modify interventions and notify the provider. C. Discontinue the sepsis protocol. D. Document findings and reassess later. Answer. B. Modify interventions and notify the provider. Rationale. Failure to meet outcomes requires plan modification and collaboration. Continued hypotension may require vasopressors or ICU transfer. Passive monitoring delays care. Question 26. True or false? If a patient stabilizes temporarily, the nurse may discontinue frequent reassessments. A. True. B. False. Answer. B. False. Rationale. Clinical judgment requires ongoing evaluation, especially after acute instability. Temporary improvement does not eliminate the risk of rapid deterioration. Question 27. A nurse must prioritize interventions for 4 patients. Which patient requires immediate action? A. Patient with COPD reporting mild dyspnea. B. Patient with chest pain unrelieved by nitroglycerin. C. Patient with controlled postoperative pain. D. Patient awaiting routine lab results. Answer. B. Patient with chest pain unrelieved by nitroglycerin. Rationale. Unrelieved chest pain suggests myocardial ischemia and requires urgent intervention. The other patients are stable or expected findings. Question 28. A nurse recognizes a potential ethical conflict between beneficence and autonomy. Which situation best reflects this conflict? A. Administering pain medication as prescribed. B. Respecting a patient's refusal of treatment despite risk. C. Following infection control protocols. D. Delegating care appropriately. Answer. B. Respecting a patient's refusal of treatment despite risk. Rationale. Beneficence urges action for the patient's good, while autonomy requires honoring informed refusal. This tension is a classic ethical dilemma tested on NCLEX. Question 29. Yes or no? Should the nurse initiate emergency interventions before obtaining provider orders when standing protocols exist? A. Yes. B. No. Answer. A. Yes. Rationale. Standing protocols empower nurses to act rapidly in emergencies. Delaying care for orders contradicts patient safety and evidence-based practice. Question 30. The nurse reviews the entire episode of care and identifies delays in treatment. Which action best demonstrates professional clinical judgment? A. Assigning blame to the previous shift. B. Participating in quality improvement review. C. Documenting only positive outcomes. D. Avoiding future high-risk patients. Answer. B. Participating in quality improvement review. Rationale. Reflective practice and quality improvement improve future outcomes. Blame, selective documentation, or avoidance do not support safe, ethical nursing practice. Question 31. A nurse is reviewing morning labs for 4 patients. Which result requires immediate clinical judgment and action? A. Sodium 134 milliequivalent per liter in a patient on diuretics. B. Potassium 6.1 milliequivalent per liter in a patient with renal failure. C. Hemoglobin 11.2 gram per deciliter postoperatively. D. Glucose 168 milligrams per deciliter after breakfast. Answer. B. Potassium 6.1 milliequivalent per liter in a patient with renal failure. Rationale. Severe hyperkalemia is life-threatening due to dysrhythmia risk. The other values are expected or mildly abnormal and do not require immediate intervention. Question 32. A nurse notes a patient receiving opioids is difficult to arouse and has a respiratory rate of 8 per minute. What is the nurse's priority action? A. Apply oxygen via nasal cannula. B. Stimulate the patient and reassess. C. Administer naloxone. D. Notify the provider. Answer. C. Administer naloxone. Rationale. Respiratory depression is an emergency. Reversal with naloxone is priority. Oxygen and provider notification follows stabilization. Stimulation alone is insufficient. Question 33. Which findings indicate a patient is at highest risk for aspiration? Select all that apply. A. Decreased level of consciousness. B. Absent gag reflex. C. Upright positioning during meals. D. Tube feeding with head of bed flat. Answer. A. Decreased level of consciousness. B. Absent gag reflex. D. Tube feeding with head of bed flat. Rationale. Reduced airway protection and improper feeding position increase aspiration risk. Upright positioning is protective, not a risk factor. Question 34. The nurse receives a verbal order during an emergency. Which action demonstrates correct legal clinical judgment? A. Implement the order and document later. B. Ask another nurse to confirm the order. C. Read back the order for verification. D. Delay implementation until written. Answer. C. Read back the order for verification. Rationale. Read back reduces error and is legally required. Delaying care may harm the patient. Implementation without verification increases risk. Question 35. A patient's pain score decreases from 9 out of 10 to 4 out of 10 after medication. Which interpretation reflects accurate clinical judgment? A. The intervention failed. B. The outcome was partially met. C. The goal was fully achieved. D. The medication should be discontinued. Answer. B. The outcome was partially met. Rationale. Partial improvement indicates effectiveness, but not full goal achievement. This requires reassessment and possible plan modification. Question 36. True or false? An expected finding after surgery should never be reported to the provider. A. True. B. False. Answer. B. False. Rationale. Expected findings may still require reporting if they worsen, persist, or affect outcomes. Clinical judgment weighs trends, not labels. Question 37. A nurse is caring for a patient with heart failure. Which cue most strongly indicates worsening condition? A. Mild ankle edema. B. Weight gain of 2 kilograms in 24 hours. C. Fatigue with activity. D. Crackles that resolve with coughing. Answer. B. Weight gain of 2 kilograms in 24 hours. Rationale. Rapid weight gain reflects acute fluid overload and impending decompensation. The other findings are common or less specific. Question 38. A nurse suspects a patient is developing acute kidney injury. Which assessment finding best supports this hypothesis? A. Blood pressure 142/86 millimeters of mercury. B. Urine output 20 milliliters per hour. C. Dry mucous membranes. D. Heart rate 96 per minute. Answer. B. Urine output 20 milliliters per hour. Rationale. Oliguria is a key indicator of acute kidney injury. The other findings are nonspecific and may have multiple causes. Question 39. Yes or no? Should a nurse override a medication safety alert without investigating the cause? A. Yes. B. No. Answer. B. No. Rationale. Safety alerts exist to prevent harm. Overriding without investigation violates patient safety and professional accountability. Question 40. A nurse reflects on a near-miss medication error. Which action best demonstrates advanced clinical judgment? A. Keeping the incident private. B. Completing a safety report. C. Avoiding independent medication administration. D. Trusting experience over protocols. Answer: B. Completing a safety report. Rationale: reporting near misses improves systems and prevents future harm. Concealment and avoidance undermines safety culture. Protocols must guide practice. Question 41. A nurse assesses a patient with pneumonia who is alert, respiratory rate 26 per minute, SpO2 91% on room air, and using accessory muscles. Which action requires the most immediate clinical judgment? A. Encourage deep breathing exercises. B. Apply supplemental oxygen. C. Obtain a sputum specimen. D. Administer prescribed antibiotics. Answer: B. Apply supplemental oxygen. Rationale: the trap is antibiotics, correct, but not first. Signs of respiratory distress require immediate oxygenation before diagnostic or long-term treatments. Question 42. A nurse receives report on 4 patients. Which patient should be reassessed first? A. Patient with chronic atrial fibrillation, heart rate 88 per minute. B. Patient with new confusion after surgery. C. Patient with controlled nausea. D. Patient awaiting pain medication. Answer: B. Patient with new confusion after surgery. Rationale: new onset confusion is an unexpected change and may signal hypoxia, bleeding, or infection. Chronic and controlled conditions are lower priority. Question 43. Which findings suggest early deterioration despite normal vital signs? Select all that apply. A. Increasing restlessness. B. Narrowing pulse pressure. C. Urine output 25 milliliters per hour. D. Capillary refill less than 2 seconds. Answer: A. Increasing restlessness. B. Narrowing pulse pressure. C. Urine output 25 milliliters per hour. Rationale: early shock presents subtly. Restlessness, reduced urine output, and narrowing pulse pressure precede overt vital sign changes. Normal capillary refill is reassuring. Question 44. A nurse administers an antihypertensive. 30 minutes later, blood pressure is lower, but the patient reports dizziness. What is the nurse's best judgment? A. The medication was effective and no action is needed. B. Document the response only. C. Reassess orthostatic vital signs. D. Administer IV fluids immediately. Answer: C. Reassess orthostatic vital signs. Rationale: the trap is assuming effectiveness equals safety. Dizziness suggests hypotension. Further assessment is required before additional intervention. Question 45. A patient signs consent but later expresses uncertainty about surgery. What should the nurse do first? A. Notify the surgeon immediately. B. Reinforce teaching provided earlier. C. Delay the procedure. D. Clarify the patient's understanding and concerns. Answer: D. Clarify the patient's understanding and concerns. Rationale: consent must be informed and voluntary. Clarification comes before notifying others or delaying care. Teaching without assessment may be inappropriate. Question 46. True or false? If a patient's pain rating decreases, the nurse may assume the analgesic dose was appropriate. A. True. B. False. Answer: B. False. Rationale: pain reduction alone is insufficient. The nurse must also evaluate sedation level, respiratory status, and adverse effects to judge appropriateness. Question 47. A nurse is prioritizing care for a patient with diabetes. Which finding is most concerning? A. Blood glucose 72 milligrams per deciliter before lunch. B. Tingling in the feet. C. Confusion and diaphoresis. D. HbA1c of 8.2%. Answer: C. Confusion and diaphoresis. Rationale: this reflects acute hypoglycemia requiring immediate action. The others are chronic or mild findings that do not pose immediate danger. Question 48. A nurse notes a slight increase in creatinine, but normal urine output. What is the most accurate interpretation? A. Kidney function is stable. B. The finding is insignificant. C. Early renal impairment may be present. D. Lab error is most likely. Answer: C. Early renal impairment may be present. Rationale: the TRAP is normal urine output. Creatinine often rises before output changes. Early recognition prevents progression. Question 49. Yes or no? Should the nurse withhold a medication if the patient questions its purpose? A. Yes. B. No. Answer: A. Yes. Rationale: patients have the right to understand and refuse care. The nurse must clarify and educate before administration to respect autonomy and ensure safety. Question 50. A nurse reviews care after a patient fall with no injury. Which action best reflects expert clinical judgment? A. Reassuring the patient and moving on. B. Documenting only that no injury occurred. C. Reassessing fall risk factors and updating the care plan. D. Completing an incident report and no further action. Answer: C. Reassessing fall risk factors and updating the care plan. Rationale: no injury does not equal no risk. Expert judgment focuses on prevention through reassessment and care plan modification, not minimal compliance. Question 51. A nurse notes a patient with suspected stroke has slurred speech and unilateral weakness. Which action should the nurse take first? A. Perform a full neurological assessment. B. Check blood glucose level. C. Notify the rapid response team. D. Prepare the patient for CT scan. Answer: B. Check blood glucose level. Rationale: the TRAP is CT scan critical but not first. Hypoglycemia can mimic stroke and must be ruled out immediately before activating stroke protocols. Question 52. A nurse receives an order to administer IV potassium to a patient with potassium ion 2.9 milliequivalent per liter. Which action demonstrates the safest clinical judgment? A. Administer the potassium as ordered. B. Verify urine output before administration. C. Ask the patient about potassium-rich foods. D. Recheck the potassium level in 4 hours. Answer: B. Verify urine output before administration. Rationale: potassium replacement is appropriate, but safety requires adequate renal function. Administering without verifying output risks fatal hyperkalemia. Question 53. A nurse identifies 2 equally appropriate interventions. Which factor should guide the final decision? A. The least time-consuming action. B. The intervention addressing airway or circulation. C. The provider's usual preference. D. The intervention easiest to document. Answer: B. The intervention addressing airway or circulation. Rationale: when 2 options seem correct, ABCs determine priority. NCLEX consistently favors physiologic survival over convenience or preference. Question 54. A nurse administers morphine for chest pain. Pain decreases, but respirations drop from 16 to 10 per minute. What should the nurse do next? A. Document effective pain control. B. Continue to monitor closely. C. Apply supplemental oxygen. D. Prepare naloxone at the bedside. Answer: D. Prepare naloxone at the bedside. Rationale: oxygen and monitoring look correct, but decreasing respirations signal impending opioid toxicity. Preparation for reversal shows anticipatory judgment. Question 55. A patient with sepsis is receiving IV fluids. Which assessment finding requires immediate action? A. Lung crackles at bases. B. Blood pressure 98/60 millimeters of mercury. C. Urine output 20 milliliters per hour. D. Heart rate 104 per minute. Answer: C. Urine output 20 milliliters per hour. Rationale: hypotension and tachycardia may be expected early. Low urine output indicates inadequate perfusion and impending organ failure. Question 56. True or false? When 2 interventions are correct, the nurse should select the one that prevents harm first. A. True. B. False. Answer: A. True. Rationale. NCLEX prioritizes harm prevention over comfort or long-term benefit. Safety-focused actions outweigh equally valid alternatives. Question 57. A nurse discovers a medication dose appears higher than recommended. The provider is unavailable. What is the nurse's best action? A. Administer the medication to avoid delay. B. Hold the medication and document. C. Consult pharmacy for verification. D. Ask another nurse to confirm. Answer. C. Consult pharmacy for verification. Rationale. Holding medication may delay necessary treatment. Pharmacy consultation allows verification and safe continuation without violating scope or safety. Question 58. A nurse evaluates a patient after an intervention. Which finding best confirms the intervention was successful? A. The patient reports feeling better. B. Objective improvement in targeted vital signs. C. The provider agrees with the plan. D. The intervention was completed on time. Answer. B. Objective improvement in targeted vital signs. Rationale. Subjective improvement is important but insufficient. Clinical judgment relies on objective outcome measures tied to the intervention goal. Question 59. Yes or no? Should the nurse question an order that is correct but inappropriate for the patient's current condition? A. Yes. B. No. Answer. A. Yes. Rationale. Orders may be correct in general but unsafe in context. Nurses must apply situational judgment, not follow orders blindly. Question 60. A nurse must choose between two correct discharge instructions. Which instruction should be given first? A. Medication side effects to report. B. Lifestyle modifications for long-term health. C. Follow-up appointment scheduling. D. Disease pathophysiology explanation. Answer. A. Medication side effects to report. Rationale. Immediate safety information takes priority over education that can be reinforced later. NCLEX favors urgent risk prevention. Question 61. A nurse reviews telemetry for 4 patients. Which finding requires immediate action? A. Occasional PVCs in a stable patient. B. New onset atrial fibrillation with rapid ventricular rate. C. Sinus tachycardia after ambulation. D. Sinus bradycardia during sleep. Answer. B. New onset atrial fibrillation with rapid ventricular rate. Rationale. New dysrhythmias with rapid rate increase stroke and hemodynamic instability risk. The other findings are expected or situational. Question 62. A nurse caring for a patient with pneumonia notes increasing oxygen needs over 4 hours. What is the nurse's best judgment? A. This is expected with infection. B. Continue current treatment plan. C. Notify the provider of possible deterioration. D. Reassess at the next scheduled round. Answer. C. Notify the provider of possible deterioration. Rationale. Escalating oxygen requirements signal worsening gas exchange. Early communication prevents respiratory failure. Question 63. Which cues suggest a patient is developing delirium rather than dementia? Select all that apply. A. Acute onset of confusion. B. Fluctuating level of alertness. C. Gradual memory decline. D. Inattention to surroundings. Answer. A. Acute onset of confusion. B. Fluctuating level of alertness. D. Inattention to surroundings. Rationale. Delirium is acute, fluctuating, and marked by inattention. Dementia presents with gradual, progressive decline. Question 64. A nurse is preparing to administer insulin. Which check is most critical for patient safety? A. Verifying the patient's diet order. B. Confirming blood glucose level. C. Assessing injection site. D. Reviewing the medication label. Answer. B. Confirming blood glucose level. Rationale. The trap is medication label verification, important but universal. Insulin dosing depends directly on current glucose level, and prevents hypoglycemia. Question 65. A patient receiving IV fluids develops crackles and mild dyspnea. Which action demonstrates the best clinical judgment? A. Stop the IV infusion. B. Slow the infusion rate and reassess. C. Administer prescribed diuretics. D. Notify the provider immediately. Answer. B. Slow the infusion rate and reassess. Rationale. Mild fluid overload requires adjustment and reassessment. Stopping fluids or medicating prematurely may worsen perfusion. Question 66. True or false? A stable vital sign trend rules out clinical deterioration. A. True. B. False. Answer. B. False. Rationale. NCLEX increasingly tests trend-based judgment. Patients may deteriorate despite temporarily stable vital signs. Question 67. A nurse must assign care to a float nurse unfamiliar with the unit. Which patient is most appropriate? A. Patient with fresh postoperative complications. B. Patient receiving a blood transfusion. C. Stable patient requiring routine medications. D. Patient with unstable blood glucose. Answer. C. Stable patient requiring routine medications. Rationale. Assignment decisions prioritize safety and familiarity. High-risk or unstable patients require unit-experienced nurses. Question 68. A nurse evaluates pain management effectiveness. Which outcome best reflects successful clinical judgment? A. Patient requests fewer medications. B. Pain score decreases with stable respirations. C. Family reports patient seems comfortable. D. Medication administered as scheduled. Answer. B. Pain score decreases with stable respirations. Rationale. Effectiveness includes symptom relief and absence of adverse effects. Objective data outweigh perception-based cues. Question 69. Yes or no? Should the nurse activate the chain of command if a patient's condition worsens and the provider does not respond? A. Yes. B. No. Answer. A. Yes. Rationale. Escalation protects patient safety and is supported legally and ethically when standard communication fails. Question 70. A nurse reflects on an adverse event and identifies a system failure. What is the most appropriate next step? A. Focus on individual accountability. B. Participate in root cause analysis. C. Avoid similar situations independently. D. Document only required information. Answer. B. Participate in root cause analysis. Rationale. NCLEX 2026 emphasizes systems-based practice. Root cause analysis improves processes and prevents recurrence. Question 71. A patient with CHF presents with sudden shortness of breath, crackles in both lungs, SpO2 89%, blood pressure 98/60 millimeters of mercury, and pink frothy sputum. The patient also has a history of chronic kidney disease. Which action should the nurse take first? A. Administer prescribed IV furosemide immediately. B. Elevate head of the bed, administer supplemental oxygen, and assess airway. C. Notify the provider before any interventions. D. Obtain a stat chest X-ray. Answer. B. Elevate head of the bed, administer supplemental oxygen, and assess airway. Rationale. Multiple traps. Furosemide looks urgent, but is secondary to oxygenation and airway stabilization, especially in a patient with CKD, risk of fluid shifts and hypotension. Immediate airway/oxygenation takes priority. Chest X-ray and provider notification follow stabilization. Question 72. A postoperative patient on PCA reports sudden restlessness, confusion, heart rate 124 per minute, blood pressure 86/54 millimeters of mercury, and O2 saturation 92%. Which cue should the nurse address first? A. Confusion. B. Hypotension. C. Tachycardia. D. Restlessness. Answer. B. Hypotension. Rationale. Subtle trap. Confusion and tachycardia appear urgent, but hypotension indicates possible hemorrhage or shock, the life-threatening problem. Restlessness is secondary and may reflect hypoperfusion. Correct prioritization requires ABC-focused thinking. Question 73. A patient on anticoagulant therapy develops nosebleeds, hematuria, and mild bruising. Vital signs are blood pressure 110/70 millimeters of mercury, heart rate 98 per minute, SpO2 97%. What should the nurse do first? A. Notify the provider immediately. B. Hold the next dose of anticoagulant. C. Document findings and continue monitoring. D. Reassess vital signs in 30 minutes. Answer. A. Notify the provider immediately. Rationale, subtle trap. Holding the anticoagulant looks correct, and vitals seem stable, but the bleeding indicates potential rapid deterioration. Prompt provider notification allows timely intervention and prevents severe hemorrhage. Monitoring alone is insufficient. Question 74. A patient with early sepsis has mild fever 100.4 degrees Fahrenheit, heart rate 102 per minute, respiratory rate 22 per minute, O2 saturation 94%, and is restless. Urine output is 25 milliliters per hour. Which interventions should the nurse prioritize? Select all that apply. A. Start IV fluids per protocol. B. Apply supplemental oxygen. C. Notify the provider of clinical deterioration. D. Continue routine monitoring. Answer. A. Start IV fluids per protocol. B. Apply supplemental oxygen. C. Notify the provider of clinical deterioration. Rationale, subtle trap. Vital signs appear relatively stable, but early sepsis presents with subtle cues like restlessness and oliguria. Delaying interventions increases risk of progression to septic shock. Routine monitoring alone is insufficient. Question 75. A patient refuses a blood transfusion for religious reasons, but hemoglobin is 6.5 gram per deciliter and patient appears pale, weak, and tachycardic. Which nursing action reflects best clinical judgment? A. Document refusal, provide alternative therapies, and monitor closely. B. Persuade patient to accept transfusion, citing risk of death. C. Notify family to convince the patient. D. Administer blood in an emergency despite refusal. Answer. A. Document refusal, provide alternative therapies, and monitor closely. Rationale, traps. Tachycardia and pallor suggest urgency, making options B and D tempting. Ethical/legal NCLEX principles prioritize autonomy. The nurse must respect the patient while implementing alternative strategies, e.g., O2, iron, erythropoietin, close monitoring. Persuasion or overriding consent is unsafe and illegal. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.